Listeners, welcome to a brand new season 7 now of Doc Talk Live. This is a health show dedicated to educating listeners about different health topics every week, and we do that by bringing on medical experts to answer commonly asked questions. So be sure to send in your questions through Facebook Live on Wednesdays at 5 p.m. You can find more information about the show on our Facebook, Instagram, Twitter, YouTube, and of course our website, doctalklive.com. That's DOCTALK live.com. Also, watch more episodes of the show on platforms like Spotify, iTunes, and iHeartRadio. My name is Dr. Vic Prakash, and I'm hosting today's show. We're talking about hearing loss, which is the third most common chronic physical condition in the United States, and it's twice as prevalent as diabetes or cancer. So joining us will be Dr. Ope Daniyan and Dr. Ceisha Ukantu to educate us more and discuss ENT, that's ear, nose, and throat, concerns in both adults and children. Dr. Ukantu and Dr. Daniyan, welcome to Doc Talk Live. Thank you so much for both volunteering your time to be a part of the show. And please tell our listeners a little bit about yourself. Dr. Ukantu?
Yes, thank you so much. It's such an honor to be on the show. I really appreciate what you guys are doing, educating our patients. It's really great. So thank you first. My name is Ceisha Ukantu. I'm an otolaryngologist, also known as an ear, nose, and throat surgeon. My practice is located in Burleson, Texas. So I serve the South Fort Worth area, Burleson, and the greater Johnson County. My practice is associated with Texas Health Hughley Hospital, which is also in Burleson. I have been practicing solo for about a year and a half, and I'm originally from the Plano area, so I'm happy to be back in the DFW area.
Always great to have a local. Dr. Daniyan.
Yes, so my name is Ope Daniyan, and thank you again for having us. This is exciting. So I have a practice in the professional building right next to the new Texas Health Mansfield Hospital on Lone Star Road in Mansfield, and we've been open there since December, and I've been practicing here in Texas since August. I'm originally from Atlanta, but me and my husband decided to make our home in Texas, and we're loving it so far.
Yeah, the warm Texas weather, right?
Not right now.
I know. What a day. Dr. Ukantu, let's start with you. We'll jump right into this. So, what is sudden hearing loss and how prevalent is it?
So sudden hearing loss is a little bit different than just your run-of-the-mill hearing loss. Sudden hearing loss is a hearing loss that occurs within a 3-day period. So you might wake up one morning and your hearing's completely gone. So whenever someone has a sudden hearing loss, we treat this a little bit differently than when someone has hearing loss over a long period of time. In a town of about 100,000 people, you'll have between 5 to 30 cases of sudden hearing loss per year.
Wow, that's actually more than I thought. You hear about people waking up blind, and that's pretty scary.
Yeah.
I would imagine not being able to hear is just as scary as well.
Yeah, definitely.
What can cause that?
So we don't actually know what causes that. And in the medical field, when we don't know, we call it idiopathic. So there's some thought that maybe it's infection or some type of inflammation that bothers the hearing nerve and causes you to lose your hearing. But we can't actually tell you exactly why it happens at this point.
Gotcha. And I imagine this is a time-sensitive issue. This isn't something you should sit on for too long?
Correct. So if this happens to you, it's really important to be seen as soon as possible. It's important to have an audiogram, which is a hearing test done by a trained audiologist. An audiologist is a medical professional that does 4 years of college, and then they do an additional 4 years of training in hearing. So they're the hearing experts, and most ENTs work with an audiologist. So you want to have a hearing test done by an audiologist, and then you want to see the ENT. Once you see the ENT, then the most common treatment and the treatment that you should have is called our high dose oral steroids.
Okay. Dr. Daniyan, if a primary care doctor thinks that their patient is experiencing hearing loss, what's the best sort of initial workup? What should they do for that patient?
Sure, and this is sudden hearing loss, right? So I think first of all, the primary care doctor should do a physical exam, so take a good look in the ears, just to make sure that there's no wax buildup or fluid behind the ear or inflammation or infection that could be causing the hearing loss. And if their ears look totally normal and the story fits that sudden hearing loss picture, then it's really important to go ahead and get them started on the oral high dose steroids immediately. And then immediately get them referred to an ENT doctor and to get a hearing test, like Dr. Ukantu said. Because once we see the hearing test, then we can decipher like what kind of hearing loss this is and how do we go forward in additional treatment and additional workup.
Great.
And I just want to add that we are talking about a sudden sensory neural hearing loss. So that means it's not because of wax or infection. When you look in the ear and it's normal, that means that there's something wrong with the hearing nerve. Exactly. And that's what we're trying to fix. The other thing is a lot of times patients will be prescribed steroids, but they won't be prescribed high dose steroids. So we often give like the steroid dose packs. That's not high enough. We need to treat this with extremely high doses of steroids to try to get the hearing back.
What are the rates of success after a steroid course?
That's a good question. I think that actually a third of patients will get better, a third will stay the same, and a third might get worse. But there are other treatments other than just the oral steroids. A lot of time, I had a patient recently, and in addition to the oral steroids, I also injected steroids into the ear through the eardrum, and she saw improvement after 2 injections, and typically we do up to 3. Some people even advocate doing hyperbaric oxygen to help patients regain some of that hearing loss, because if it is due to some, decreased oxygen around the hearing nerve, then we think that, providing that hyperbaric oxygen would also perhaps help the nerve. And so I think the steroids by mouth, steroids injected, and also the hyperbaric oxygen treatment has had good success.
Great. Good to know there's multiple modalities in case first line doesn't work.
Yeah.
Dr. Ukantu, how does one protect their hearing?
I think this is a really important question because we see a lot of patients who have been going to concerts all their life, who have been shooting guns without hearing protection, and then they come in and there's nothing we can do about it besides a hearing aid. We can't actually get the hearing back. So we want to preserve our hearing so we're hearing into our 90s when we're still walking around and being active at that age as well. And ways that we can do that are, one, if you're in a loud, noisy environment, you need to wear hearing protection. So if you're at a loud concert or, shooting guns like we just talked about, hearing protection is key. If you work in a loud environment, a factory or somewhere like that, your employer should be providing you hearing protection. Additionally, other things we can do are not wearing our headphones too loud. So we see a lot of people who just blast their headphones at the highest level, and then they come in with hearing loss. So whenever you're wearing headphones, the person next to you should not be able to hear what you're listening to. And then lastly, just being healthy. So exercise, diet, things that cause diabetes and hypertension. We know that people who have chronic medical conditions like these also usually have a correlation with hearing loss. So we just want to be healthy, exercise, diet, don't smoke, things like that.
Great. All great tips. Out of curiosity, is there any difference between in-bud headphones versus over-the-ear headphones?
I'll let Dr. Daniyan take this question.
I mean, honestly, I'm not sure. I mean, I feel like the in buds would probably, hurt the ear a little bit more than over the ears. But I'm not 100% sure. But
I would agree with that.
Yeah,
I haven't seen a lot of research saying one's worse than the other.
Okay. So
But
it really comes down to the decibels.
I think, yeah,
Right,
exactly,
for sure.
exactly.
Okay. And then I have to bring this up because I think we're all guilty of being either taught it when we're young or our grandmas did it for us, but putting an earbud in your ear canal to clean out the wax.
Yes, I did forget to mention that. We want to
Yeah.
avoid trauma to the ears. So no Q-tips, no bobby pins, no pencils. Do not stick any of that in your ear because we see so many times it goes too far and then you have a traumatic injury, you lose your hearing. So just be careful.
Yeah, we usually say don't put anything smaller than your elbow, right?
Yeah,
something
exactly.
like that. Don't put anything smaller than your elbow
in
your ear canal.
Right. Dr. Daniyan, what's chronic rhinitis and what's the treatment for that?
Okay, so chronic rhinitis is a very common problem. Rhinitis is just like inflammation or swelling of the lining inside your nose, and typically patients would present with runny nose, stuffy nose, sneezing, and we call it chronic when it's lasted for over 3 months. So the treatment depends on the cause, and there are lots of causes to have inflammation in the nose. But one of the most common causes is allergies. And so, just environmental allergies like dust or pet hair, grass, mold, trees, they can trigger, our noses to kind of, get inflamed and start running and get really congested. And so the treatment for allergic rhinitis, we call it, is first of all trying to avoid those triggers if possible. And then we like to use some nasal sprays, so we use steroid nasal sprays which decrease swelling in the nose. And then we also use nasal rinses just to help clean out the nose, clean out the mucus, the dirt, all the irritants. And then we also use anti-allergy medicines. They come in pill form and in nasal spray form. But we like the spray better, and studies have shown that using the anti-allergy spray with the steroid spray help to improve that inflammation in the nose better. And then if those don't work, then we could get allergy testing and allergy shots.
Great. Are a lot of these prescription or are some of these over the counter?
Sure. So the most popular steroid nasal spray is called Flonase. I'm sure some people have heard of it, and that is over the counter. But I've noticed that when we write a prescription, it's actually cheaper for the patient. So I typically say, I'll write you a prescription, but you can pick it up if you want to, or just get whichever is cheapest.
Right.
And then those anti-allergy sprays are prescription as well.
Gotcha. I know you're new to Texas, but allergies here are pretty rough year-round.
I have seen. Yep.
Dr. Ukantu, when is surgery indicated for chronic rhinitis?
So when you try these things and you don't get any improvement, we call that failed medical management. So medical are all the things that we can do without doing surgery. And so once you fail medical management, there are some things surgically that may improve the symptoms that you're experiencing. One of them is called a turbinectomy or turbinate reduction. So you have these little swellings at the bottom of your nose called your inferior turbinates. And sometimes they can cause you to feel very congested and like you're not getting a lot of air through your nose. So we can make those smaller to allow you to breathe better through your nose. The other procedure is a newer procedure that we've been using. It's basically freezing of some of the nerves in the nose, cryotherapy for the nasal nerves. And the trade name for that procedure is called a Clarifix procedure. And so for people who have a lot of runny nose and drainage through the nose, this procedure works really well. You freeze those nerves. It's only about a 20-minute or less procedure. We can even do it in the office. So we freeze those nerves, and then over the course of 4 to 6 weeks, most people see a relief in the amount of nasal drainage and congestion they're experiencing. This is a newer procedure, so not all ENTs offer it. It is becoming more prevalent in the ENT community, but we are happy to announce that we both offer it in Burleson and Mansfield if this is a procedure that you're interested in. It's called the Clarifix procedure.
That's wonderful. So for all our listeners suffering from chronic allergic rhinitis, it's good to know there's an option that can really help you.
Definitely.
Yep.
Good. Dr. Daniyan, let's switch gears a little bit.
Okay.
Can you tell me a little bit about obstructive sleep apnea?
Sure. So obstructive sleep apnea, I'm going to be talking about for adults generally. It's basically when all or part of the airway is blocked repeatedly during sleep. And during these periods, there's decreased airflow and oxygen flow into the lungs and to the rest of the body. There are lots of different causes for these obstructions in the airway. One is that when we sleep, our muscles relax, and so the muscles in our airway relax and sometimes tend to fall into the airway and cause an obstruction. Another cause is obesity, people with thick necks, and then large tonsils or large tongues, especially the back of the tongue. Those are some causes. And patients will typically have very loud snoring. A lot of times they wake up in the middle of the night gasping for air or choking. And a lot of them experience sleepiness during the day just because they haven't had a good night's sleep. And it's a big problem, and it's really important to be aware of and look for signs in sleeping partners, because untreated sleep apnea can lead to devastating cardiovascular issues, like issues with your heart, lungs, sudden death, stroke. So it's very important to get evaluated if you feel like you might have sleep apnea or someone you love might have obstructive sleep apnea.
Good advice. What are some of the treatment options for this?
So there are lots of options. There's lifestyle changes, which everyone loves. So weight loss is super important. I think even if you lose like 10% of your body weight, you might experience like significant improvement in your sleep apnea. Then there's a CPAP, which some people might have heard of. It's a machine that delivers positive pressure, like pressurized air, into the airway. So it's a machine attached to a tube that's then attached to either a face mask or that goes over the nose or mouth or both. And that basically works to keep the airway open. So it's like stents it open when we're sleeping, and that avoids tissues falling into the airway. And that's a great treatment. Then there are some oral appliances that dentists help fit patients with that help to move the jaw forward and open up the airway that way. And then there are lots of different surgical treatments as well that basically address different levels in the airway that might be causing the obstruction.
Okay. Yeah. Dr. Ukantu, should someone be concerned if their voice becomes gradually hoarser over time?
Yes, they should. So hoarseness, if you've had it for less than 2 weeks, then it could just be you had a recent upper respiratory infection or, a bad cold, and it affected your voice. But after 2 weeks, your voice should be starting to come back. So if you've noticed that you're hoarse for longer than that time period, it's really important to be seen by an ear, nose, and throat doctor. And the reason why is because there can be something else going on. So there's benign things like nodules, vocal cord polyps, and there's things that are more scary, and like a vocal cord cancer. And so for people who've had that hoarseness for a long period of time, we want to evaluate as soon as possible. So if they do have something more scary like a vocal cord cancer, we can treat that. And that is something that's very treatable. And so the earlier you come in, the earlier we can get on it and we can cure you.
Great. Dr. Daniyan, could you tell us how you guys visualize the vocal cords? Is that a surgical thing or an in-office thing?
Sure. So that's an in-office thing. We call it a fiber optic exam of the larynx. And so there's basically, a fiber, which is like a string that's attached to a camera and a light source. And at the end, there's a little camera. And we advance that into a patient's nose. And then it's flexible. And through the nose, we're able to go to the back of the nose, the back of the throat, and then visualize the vocal cords that way. And typically, we give patients some numbing medication and a decongestant in their nose just to make the procedure more comfortable. And we even do this on kids. So, sometimes we have to hold patients' hands through it, but typically everyone can tolerate it awake in the office.
Okay, so that's good to know. So if someone presents with this problem, they can maybe get visualized that day and have some answers right away.
Yes, exactly.
And I always tell patients that it should be uncomfortable because no one likes having anything in their nose, but it shouldn't be painful.
Right.
Okay.
And so most people tolerate it well.
Yeah.
Fair enough. Dr. Ukantu, what is chronic sinusitis and how are sinus infections typically treated?
So chronic sinusitis, there's that word chronic again, so that means it's been present for over 3 months. But it's a infection of your sinuses or inflammation of your sinuses that's been present for longer than 3 months. And so in those patients, common symptoms include drainage from the nose, congestion in the nose, facial pain and pressure, headaches, even decrease in smell and taste. And what was the question?
Oh, well, what is it which you're answering and how can it be treated?
Okay, and how can it be treated? So we go back to starting to trying medical things first. So that would be things like the nasal steroid sprays that Dr. Daniyan talked about earlier, nasal saline, irrigations through the nose, antibiotics, usually for a longer course. And then if we try all those things, and the patient is still having symptoms, then we'll get a CT scan of the sinuses. And that scan will allow us to see if there's inflammation within the sinus cavities. If there's inflammation in the sinus cavities despite maximum medical management, then we would proceed with discussing a sinus surgery. So basically, when we do a sinus surgery, we're opening up the sinus cavities so that they drain better and it improves some of the symptoms that you're having.
Great. We're getting close to the end of our show, but I'd be remiss if we didn't get one question about kiddos in. Dr. Daniyan, is snoring in children normal?
So snoring can be normal in kids, and I think in about 10% of kids, 10% of kids snore regularly, and it's not an issue unless they have certain, signs and symptoms, and those can include mouth breathing, tossing and turning during sleep. Parents sometimes notice that gasping for air again, like when I was talking about the obstructive sleep apnea. Sometimes kids have behavioral issues in school, and those are some of the things that would say, this is not very normal. We should get this checked out.
Okay. Now, since we're getting close to the end of the show, if you guys can both give me a one-liner for what you want people to really remember from today.
Sure. So what I would say is that a lot of people think of ear, nose, and throat disorders as something that, I'll get checked out later, you're not dying, you're kind of tolerating it. But I just want to say that quality of life issues are really important. So issues with hearing, voice, swallowing, that's really important. And I would encourage patients to come to the ENT to improve their quality of life.
Dr. Dani?
Yeah, and I ditto what Dr. Okatu said. And in addition, we always have tricks up our sleeves, I feel. So if one thing doesn't work, there's always something else we can try. So I just want to say that to just give patients hope that, we do want to help improve quality of life. And we try lots of avenues to do that. So.
Wonderful. Thank you both so much for coming on the show. This is Dr. Prakash signing off another episode of Doc Talk Live. Stay healthy, America.